and safety of our citizens. We have detailed emergency plans in place for each of our departments. With this declarations, these emergency operation plans have been activated. We will make a detailed announcement tomorrow with the changes citizens and the public will see to city services and operations. We'll be holding a special council meeting tomorrow night, Friday at 6 p.m. here in City Hall, and we will be canceling the council meeting scheduled for March 16th and the study session scheduled for March 23rd. Additionally, we expect that many non-essential events will be canceled or postponed in the coming weeks, and some public facilities will be closed. We encourage the public to limit any non-essential activities, and our city staff will be providing limited services while we focus on issues of health and safety. This declaration is to protect our community. We at this time have no known cases of COVID-19 in Independence. However, we have many citizens who are aging in place, who have other vulnerabilities to the COVID-19 and other diseases. And we are doing this out of an abundance of caution for the public health. We take this decision very seriously and will continue to work with our peers in the region, the state, and federal agencies. We are regularly communicating with these entities to ensure we have the most up-to-date information, and we will share this information regularly with the public throughout this event. We are the 5th largest city in the state of Missouri. We cover 78 square miles and have a diverse population and workforce. This declaration is out of an abundance of caution to ensure we can respond immediately when it is needed. As new information is available, we will update our staff and the public appropriately. You can also find these updates on our city website, indep.us/coronavirus. We will provide detailed information on changing services tomorrow. That is my statement. We do need to turn this room over for court. I think we're going to move across the hallway to conference room D to answer further questions. Thank you. You want to take them here? Okay, we got a few minutes so we can take questions here. I want to introduce Zach Walker, who is our city manager, Christina Heinen, who's our acting health director, and Chief Doug Short, who is our fire chief, so you can direct your questions to any or all of us. We have not made that determination. We will have more information tomorrow and more details. At this point, we are not putting a capacity cap on those types of things. We're asking citizens to use their best judgment in attending events or participating in activities that aren't essential. So we will have more information in terms of city facilities and events in the next day, but we at this point have not encouraged people to cancel events according to how many people that they would expect to attend.
When did you come to this decision? Was this last night, yesterday, or this
morning? Well, we've certainly been talking about this potential for several days. And really, in the last 12 hours, we've understood that this is really requiring some kind of immediate response. So we've been meeting last night and this morning in preparation for this announcement.
Given all the need to wash hands and all that stuff, water shutoffs or anything like that, has there been any decision on that?
I'm going to ask the city manager, but to my knowledge, that hasn't been contemplated at this point. This is really, the state of emergency is being declared so that we can begin preparations for if and when we do have a confirmed case in Jackson County or the city of Independence. Chief, do you want to say anything more about that?
Yeah, Doug Short, I'm the fire chief. Basically, the reason we declare this emergency is it puts our emergency operations plan into place. It allows us to make decisions on whether or not we need to reduce services or we need to make recommendations on public health. And it brings us all together, not only as the city, but as the county and some of our partners, school districts, Chamber of Commerce, and those to make those decisions informed and based on what really needs to happen. While the mayor says, yes, we made this decision in the last 30 days, or in the last couple of days, actually, as a whole in the city, we've been looking at this for the last month. And we've started getting those plans out, seeing what needs to happen, starting to fill in. An emergency plan is a blank template. And what you have to do is when that emergency comes in, you start to fill in the gaps and say, this is how you're going to deal with that emergency. So we're looking at that. We're putting those things together now. We've been putting those things together. And we should, as by tomorrow, we'll be doing some of those more specific things on the services that are being taken care of, how we're going to address those, how we're going to address employees, especially those that are out there as first responders or direct public contact. And then we'll be getting with our partners to decide as a community how we start to address some of the other mitigation plans going forward as well.
Are there any parts of this emergency operations plan that you can share today, that you were able to share today?
Well, I mean, what specifically would you like to know? I mean, the emergency operations plan is,
Protocols or anything like that?
yeah, I mean, the emergency operation plan is basically broke up into several categories. It deals with how does how does the upper structure work? How does public health work? How does emergency services work? How does the water department work? How all of those flow together. So basically what we're concentrating on right now is our health section, which is our public health section of our emergency plan, which basically we take direction from Jackson County Health Department, who takes direction from the state of Missouri, who takes direction from the CDC and the federal government. So as those things flow down, then we develop our plans to be more stringent at that point. We have protected equipment in place that's been there for many years. Now you might see it used a little bit more often. Okay, we'll have the proper protective equipment for our firefighters. We've had that equipment for them. Its awareness now jumps a little bit higher to know what's going on, to be aware of their situation a little bit more keen and direct with each one of those calls. So they have that operation. Probably what the public needs to know is, yeah, we might look a little different coming into the house now. Where before we may not have had a gown and a mask on, we might this time. Or you may see something like a reduction. So you may only see one person initially that walks through the door. They're going to do some quick questioning to see if there is a risk. If there is, they'll take precautions with the patient, and then they'll bring the rest of the crew in along with EMS to treat the patient.
So going along with that, then, have there been specific changes to dispatch protocol to ask questions ahead of the arrival of the first arriving unit regarding symptoms and, of course, travel?
I'm working a little bit more because we have a third-party service for EMS here. I know they are following some current guidance that's been put out there by the CDC as well as the Ambulance Association on additional questioning that it should be taking place. It's going to even change and evolve more probably over the next week. Right now, it's just those basic, simple questions that are generally asked, but only until you hear something specific that leads you to that. Where in the future, it's probably going to be included in that entirety of the normal medical questioning that takes place during a medical call to 911. Yeah, well, in the particular exposure that you're just discussing, yes, we worked on that as far as making sure that the communication back and forth between the hospital and our staff to put those things together, Essentially, with Jackson County, the reason they take that over is because they have a larger abundance of information. So they can put the pieces of the puzzles together to decide if we're dealing with a potential case or not. And it'll fall the same way. The hospital will notify Jackson County, as well as we probably will also be notifying Jackson County, and they'll start their investigative process in that, which is a normal pandemic process.
We have time for a couple more questions.
Just one more question. I talked to a lot of people yesterday who were after being told for a minute before it happened, and they were not afraid of the coronavirus. They said, oh, they're just trying to make us scared. So what is your message to people just about how serious this actually is?
So our message is, just like many other illnesses throughout the United States that we're dealing with right now, it is something serious that you need to consider. Although for a lot of people, it may just result in those cold and flu-like symptoms, in some people it becomes very serious, and especially those that have those pre-existing conditions and are over a certain age, it can be very serious and life-threatening. So we want to take every caution possible, and we want people to just keep it in mind that they should be taking those simple precautions. They should do some, distancing, social distancing. They should be washing their hands. They should, if they feel ill, they should be staying home. If it's non-essential, maybe right now is the best time to try to keep that peak down on our number of cases.
One more question?
Any idea how many testing kits are available in the city?
So, no, I do not have that number.
We had a call with the governor earlier this week or late last week. At that time, there were 800 in the state of Missouri, but more being produced and on their way across the nation. I expect that we will continue to be included on those calls, both with the governor and on the national level, and continue to monitor that. So again, as more information comes out, we will make that information available.
Schools, has that decision as far as classes been left up to the various superintendents?
Yeah, so again, Zach Walker, city manager, starting last couple of weeks and then really intensifying last night, I've been in coordination and communication with our key stakeholders, including representatives from the school districts. The school districts are continuing to make the decisions that are in the best interest of their students and of their employees as well. But right now, they are continuing to maintain status quo, though. Each of the districts I've spoken to are reevaluating some of those non-academic related activities, such as athletics and other extracurriculars. There are some limitations on travel that are happening with those, but we are keeping one another informed of our activities, information and resource sharing, and we'll continue to have those conversations throughout the day over the next several weeks and months, as long as this takes to get through this.